Started your timing.
Yes, ma'am. Okay. Hello, I'm Dr. Geeta, one of the doctor in the gynae clinic today. May I confirm your name and age, please?
Yes, doctor. I'm Mary McNaughton and I'm 37-year-old.
How would you like to be called?
Oh, yeah, Mary is fine.
Okay, Mary, I have gone through your GP letter. I'm aware about your situation, so please accept my condolences for your loss. How you and your son are coping with this?
Yeah, doctor. Initially, it was really tough to come in terms with the situation, but I'm better off now. Thank you for the inquiry. Thank you for the condolences.
Mhm. Yeah, that's really good, Mary, that you are coming with the. I have gathered that you want to have another baby. That's really good thing. So, Mary, to help you better, can I ask you a few questions to know more about your health and your condition so that we can I can better explain you about the options?
And yeah, it's okay, doctor.
Yeah. So Mary, I gathered from your notes that you want to discuss about the donor insemination and you have one more baby. So may I know about your uh, what you basically know about that other options, or have you searched out anything?
Uh, Actually, doctor, yes, I had read about on internet about this donor insemination. I had lost my partner a couple of year back in a road traffic accident, and I cannot
Mm-hmm.
see anyone with whom I will be comfortable to go ahead, or I'm not looking forward to have any relationship. So, and we always wanted, me and my husband always wanted to have two babies, so that my son will not be all alone in this world. And that's the reason actually I wanted to have another baby. And I have searched about donor insemination, and I thought it is the only feasible option in my case because I'm not looking forward to meet someone in near future.
Yeah, I respect your your concerns, and I will try my best to address all your concerns. May I know about your periods? Any issues in that?
No, doctor. My periods are pretty regular and they're bang on time. And my last period was 2 weeks back.
Mm-hmm. Okay, and I need to ask you a few intrusive questions. Please don't mind. Whether any sexually shared infections in the past?
No, doctor.
Any previous surgeries?
No.
Mm-hmm. And please don't mind it. Generally, we ask that question. It may be hurting for you. So, any future plans or future thoughts regarding any other partner?
I told you, doctor, just now I'm not looking forward to have any relationship.
Okay, sorry, I got that point. And what about your delivery? How was the mode of delivery? Like,
Yeah, my son is now 2 year old, and I delivered. It was a
mhm,
straightforward delivery at the time of Luke's pregnancy, and straightforward
mhm,
pregnancy also. So yes, normal delivery.
okay. And you are generally fit and fine, right? As I gathered from your notes.
Yes,
Mhm,
I'm very fit and
mhm.
fine. I have to remain fit for
That's
my
good.
baby. Yeah.
Yeah, that's really good. Have you received any rubella vaccination?
Yeah.
That's good. Are you taking a folic acid?
Yes.
That's good. Allergy to anything?
No,
What about your body weight height ratio?
it's normal.
Any social habits like smoking,
Oh,
alcohol,
no,
any recreational drugs?
no.
Yeah, please don't mind, Mary. For the safety of your upcoming baby, may I know how's the financial and otherwise support at home?
Yeah, yeah, I'm a solicitor and I am having a very good sound financial situation at my end.
Yeah, that's good. Do you feel down, depressed, or not interested in doing things in the past?
No, I'm
Mhm.
okay, doctor. I don't have any concern.
Okay. And Mary, have you find out any donor in the friends, family?
No, I haven't any idea about the donor person.
Okay. Thank you for sharing all the information, Mary. Coming over your concerns regarding the options. So, for the donor insemination, where the processed sperm will be injected into the womb. In this process, it can be done either at a privately at the home, or it can be done at the fertility clinics. When it is done at the fertility clinics, where the sperm and you will be checked for the infections, particularly HIV, hepatitis B, syphilis, and also for the genetic conditions. Am I clear up to this point, Mary?
Okay. Which genetic
Yeah,
condition,
and
doctor?
like any genetic conditions that may pass
Okay.
from the donor sperm into your baby.
Okay, okay, doctor, got it.
Yeah, yeah. And before that, we offer you a certain test as one of the test called as a progesterone level that I gathered that is normal. That means your ovaries are releasing the egg. We will also offer you another test, X-rays, to check whether the tubes are open and also screen for the infections. Okay.
Okay.
So, yeah, for the donor examination, this procedure is, Mary, I'm sorry to say, in your case, most of the time it is not funded as you have already a baby.
I'm okay with that, doctor, but I just wanted to know my options.
Yeah, in the donor examination, you can find out the donor either from your family, friends, or there are the certain agencies. Even you can, there are the fertility clinics. You can also get donor from that as well. But in that case, nowadays, because of to find out donor, it is a difficult because of the anonymity, abolishment of anonymity. That means you can find out who's you can find out certain characteristic of the donor, like his ethnicity and his certain personal characteristic, but you cannot know identify who is he. Okay, Mary.
Okay,
And
yeah.
even your baby, when he get 18-year-old, he can find out who was the biological father. But regarding the legal implications, the donor will not have any responsibility. And on the birth certificate, you will be the only birthing mom, and the father will be written as an unknown. Am I clear up to this point, Mary?
Yeah, quite clear.
Yeah. So, Mary, regarding the other options, we have the options like adoption, or you can we can think about the test tube baby or the reproductive tourism. Do you want to know about anything particular?
Mm, Actually, I'm not keen to adopt any baby. I would like to have my own biological baby. And
Mm-hmm.
regarding biological tourism, yeah, I may need to consider that. So,
Yeah.
what will be
So,
the
Mary, in
cost approximately, and what will be the success rate if I decided to go privately for this IUI?
yeah, regarding the cost, I'm not quite sure. I will put you in contact with the fertility clinic specialist and will write your GP and also the clinical commissioning group regarding the how much the cost. And regarding the success, it is seen that with the sixth procedure, 50 out of the 100 women, it is successful. And if not in the sixth cycle, then
Hello.
another six cycle, 75 out of the 100 women, it is successful.
Okay,
Okay.
that's a good success rate, doctor. Yeah. So I may go for a
Yeah.
private situation. I'm okay with private funding, but I'm not keen on alternatives. Uh,
Sorry.
I'm not keen on any
Could you please?
alternative.
Yeah, surely. So I will
Okay.
give you detailed information regarding the donor examination. You can go through that.
Okay, she's
I
getting
will arrange a
4
meeting with my
to
consultant
35.
and fertility specialist as well. Will write back to your GP. Mhm.
Okay.
Hmm.
Yeah.
And will arrange some investigations as well.
Just to
I'm
see for some
documenting
time if it
whatever
is
I have
not.
discussed here.
No, she is a primary or
Who is okay? Uh, yeah, doctor, you can just put it across my
Yeah,
paper.
yeah, yeah. I'm arranging some investigations for you. I'm giving you the written
yes.
information, whatever I have discussed here.
Okay, thank you,
Okay,
doctor.
Mary, anything else that you want to know?
No, that's it, doctor. You have had a very good discussion, and I'm okay to go ahead with this.
That's great, Mary. Thank you so much for your time.
Doctor. Now, last 6 minutes, well within time. Okay, completed. Your
Mm.
feedback, anybody wanted to give some feedback, some positive points, some negative points, and then we will discuss it. Okay. Uh, your own feedback, Dr. Geeta.
I think I missed some safety points, like I missed confidentiality.
Why
And
confidentiality? Why you are worried about confidentiality? Hmm?
because in the fertility sessions, fertility task, I think we have to mention confidentiality.
SRH module.
Maybe.
SRH module. In SRH module, you need to assure about confidentiality. When it's a straightforward station where nothing is going to harm. Means, see, it's not a psychiatric condition or it's not a taboo, something like HIV, HBsAg, or HCV. You do not need to assure them about
Mm,
confidentiality. In sexual abuse, you need to assure them about confidentiality. This is a straight task,
mm,
dear. You need to assure her about confidentiality. No need. Okay.
okay.
Yeah. So anything else? Very well done.
Okay.
Huh? I really say that very well done,
Mm.
station. Okay. Anybody wanted to comment on her performance? Shall I comment on it? Anyone?
Ma'am, I can't see the slides. Is there any slide in the screen?
What about others? Are they able to see?
Yeah,
Yeah,
ma'am, we can see.
yeah, audible, and also see.
Yeah,
Yes.
it's audible, but I can't see the slide. I don't know
Then
why.
the
Might be
issues,
some
yeah,
problem.
then the issues, no, then the issues at your end, most probably it is a slow internet.
No, here the internet connection is very good. Just only your name DM is coming on my slide. So I'm just thinking might be just only on my side, or is there this issue is on the other side as well?
No, everybody, I hope everybody is able to see the slides.
Yes, ma'am, it is
Yes,
visible.
ma'am.
Yes,
Yeah.
ma'am.
Yeah.
Okay, might be something is here. Okay, I will check it. No problem.
Okay. Now coming to my feedback, Dr. Geeta, a very well done task. Very well means we will go, although we will go through the answer key. Very well attempted. Very having a very good situational awareness, appreciation. In spite of having a difficult time, she's having to keen to have a baby. Then checking donor UI knowledge, checking whether she's having anyone, then taking a quite relevant history. I will not say irrelevant history. Most of the history were taken very relevantly here, and the management was up to date. uh, Appropriately mentioned management, acknowledging the information whatever has been given. Only points what I have mentioned here is regarding your performance. When I mentioned that I wanted to have a baby, so appreciate here, but at the same time, may I know why you are keen to have? I really appreciate the way, because you wanted to have more babies to you wanted to have more babies. But may I ask you why you are keen to have more babies? That why is very important. Okay, listen to that word. Okay, then I told you, because I do not want my son to be alone. So that why many a times is a star information in information gathering. That point always remember. Ask why I am keen. Then very nicely you were humming up, oh, oh, very good. when I explained you that I am not keen to be in relationship with anyone, and the GP has already mentioned, so see to it that you will not touch upon this point again. Twice it has been mentioned. The GP had already mentioned. I already mentioned. Take it, because sometimes this is a triggering point for the patient, and they may get agitated, or they may get angry. Avoid, okay, that information. Avoid if they had mentioned. That is my second feedback to you. Then my third feedback to you, yeah, when it comes to discussing or offering a sensitive option, something like adoption, something like surrogacy, always take a permission from the patient. Okay, so are you interested to know alternatives? Will it be okay if I discuss the alternative option like adoption? Something like that. Sentences you can use that will go very well with the role player, and even if the lay will be there, directly telling them the alternatives are adoption will may not be taken very uh, positively by the role player or positively by the lay. Okay, so whenever we are discussing certain situations, something like surrogacy, something like adoption, where the patient, these are the options where everybody is not keen. Okay, everybody is not keen to go ahead with adoption. So here, just sensitively touch upon this topic. Would you like to discuss alternatives, something like adoption? If you are, then we can discuss it in detail. Okay, take a permission prior to saying these options. That is what I wanted to say. So these are only 2 or 3 points what I had mentioned here. Another point, if you can take a help of drawing. Okay, so yes, whatever knowledge you are having about donor insemination is correct. So I am just drawing it for you. So this is a vagina, and this is a sperm, which actually intrauterine sperm. Okay, so just draw some uterus, draw some small sperms, and just tell her this will be having a very good impact when it comes to communication with patient domain. Okay, so this kind of communication will always be taken on a positive note. So drawing is very important. And lastly, not least, any patient information leaflet regarding donor insemination, specific name, and specific support group. That is, Fertility UK is a support group which you have to mention. Okay, knowledge part, it is okay if you will not be knowing what is the cost of treatment or IUI in the private thing. Okay, so far as a very nice station, very nicely done up. I will just go through the answer key what I had mentioned here. Okay, so introduction, confirming patient identity, situational awareness, single mother, loss of partner, offering condolences, how am I coping, do you need any help in the form of counselor? No, I am not. I was okay. Now it was a history, it was a past, so no need to offer me counselor if I am comfortable. Okay, if you think that I am still stuck up in my past, then please ensure that you will offer counselor. It is actually your judgment. Appreciation for being strong, offer decision to have a baby to accompany her 2-year old. Okay, here you had appreciated very nicely, but at the same time you can ask me, may I ask why you are keen? I don't want to offend you, but this is just for our own yeah, because we have to see, because you asked me of financial security, so same thing we have to ensure that the safety of up, upcoming baby. Okay, aim of consultation, you had said it very rightly, Mary. We are going to discuss options of motherhood. So I am going to ask you few questions about you, and we'll discuss the management. Aim, setting agenda, gather all information, and we need to ask you certain information again, and then option of being mother by IUI process. Here you can directly build a rapport by asking what is the name of your son. Okay, what is the name of your son? And how he delivered. 1 2 questions had been completed. If not asked here, you can take a regular history. The GP did a blood test to see whether you are releasing egg regularly or not, and this report shows you are releasing the egg regularly, which I had mentioned here, you had mentioned after taking my history. So anywhere it can be taken into consideration, not to worry about this information, but you have to acknowledge, and you had acknowledged that information. Menstrual history, detailed history you asked. Smear history you missed out, dear. Yes. Hello.
Yes, ma'am. I missed
Yeah.
it.
Yeah, you
Yes,
can ask
yes.
me your history. Then STI history, surgery, tubal test status history. You had asked me very detailed previous contraception, especially IUCD contraception, because we also wanted to rule out complete history. GP has also mentioned that you are fit and well. May I know your BMI? May I know your blood group? Okay. Personal history, specifically occupational, smoking, alcohol, and drugs, which you take it, and support. Support is very important here, financial as well as what I will say, family support, because she is a single woman. So, are you emotionally also stable, and do you feel supported by your family and friend? That is very important information. Mental history also you took. Thank you for sharing all information. Your information gathering was 5 minutes, but still okay, because you could able to finish out your station, your task within a stipulated time. A straight communication task this is. So, do you have any idea about donor IUI? I have checked my patient knowledge here. You had checked my knowledge in the beginning, so nothing to worry. Checking background knowledge is important, and if I know the correct thing and then emphasize, yes, whatever you had telling me is right. So to have a healthy pregnancy, we need to have a sperm from male called called a sperm donor, and artificially we can put this sperm into your neck of the womb around the time of egg release. This is known as donor IUI, and it is legal in UK. This is one terminology what we need to use. This is legal. So a healthy male will be screened. I thought means when you said na, I was somewhere for that flash of second I was lost somewhere, and I thought you were saying that I need to screen you for genetic disorder. That's the reason I had asked you what regarding genetic condition, but then immediately I picked up, no, you wanted to say that you will be screening a healthy male for infection and genetic condition, which you had mentioned. And we will match the color, race, height, and it is all for altruistic reason. They will not get a monetary benefit. Okay, they will be getting a very mere rupees or mere pounds. So it is only for altruistic reason. But names and addresses of the concerned donor will not be revealed to you at this point. They are anonymous at this point. This you have to explain me here. As of now, yes, they will be, you can select it by the race, you can select it by the body structure, color, height. They will be screened for any sexually transmitted infection, bloodborne infection, and genetic condition. But at this point it will be anonymous, and it will be for altruistic reason. But as there is a change in law of UK anonymity, a a baby born out of this donor insemination will have access to the detail of this father by the age of 16, and he can access, or he can meet, or he can access the person after 18. Okay, he can go and he can meet the person after the age of 18, but after the age of 16 he will have all the details of the donor. And that's the reason UK is facing a shortage of donor, and there is a long waiting list. uh, Also, child born by this procedure will not have any legal rights on donor, and unknown will be written on the birth certificate. Unknown will be written. This is what you have to say. Your name will be there at the time, at the place of mother's name, but the father's name will be written unknown. It will not be written by it, there won't be any name. I'm also afraid that your request for IUI may not be accepted or may not be funded uh, by NHS. And if you are keen, you can go for a private donor insemination at private fertility clinic. Okay, if you are going for private fertility clinic, they will be charging you around approximately 700 to 1600 pound or £1,000 per cycle of IUI. And the success rate is correctly you mentioned about 40 to 50% after 6 cycles. So it is 10 to 15% per cycle. So the success rate I will take it as a positively, and decrease as age advances. Other possibilities, if you would like, you had like to use a friend or someone you know, you can have a treatment with their donation at clinic if you are accepted privately, or if you are accepted by NHS or in the private clinic. If you are knowing any donors, sperm donor, you can bring your family friend or someone known to you. So that is another option what you are going to give it to her. The third option will be, okay, now we are going to offer her certain tests. Even we are going to test her for STI and tube test, which you had mentioned. Rubella also, if not been done here, okay. Start her on, if not started on folic acid. You asked me, I told yes, I have started. So you had opt for, means here, continue folic acid. That will be the only sentence. This will be a overwhelming journey. Counselor is an important part of this journey. They will they will offer you support and guidance at each visit. It is very important. And Fertility UK is a support group, so you can be in touch with these people who had a similar situation or had gone through the similar situation. Do you wish to discuss, here I had mentioned, do you wish to discuss the alternatives other than IUI? If yes, you can think of adoption or fostering a child. Also, fertility tourism is another option, but we are not abide by the rules and regulations. They will be different in those different country. Our rules and regulations will not be valid over there. Okay. Although GP, now here I am taking an opportunity. I'm really sorry. I'm little bit intrusive. Although the GP has mentioned that there is a remote possibility of meeting a new partner, but that is another way if you consider it. And sorry if it has hurted your sentiments. Okay, that means in upcoming days you can find out a new partner, and you might be in a new relationship, and that is another way of getting pregnant in upcoming days. Okay, so this is another option which you have to touched upon very sensitively. You have to use a sensitive approach when you are going to see this patient. Okay. Do you wish to discuss any other concerns? No. Offer PIL about donor IUI. Write back to the GP, which you had missed out, dear. Did you missed out writing back to the GP? Okay. And if any further queries, she can put in touch with the consultant. Thank you. Okay. So when it comes to communication with patient, vulnerable, so sensitive, non-judgmental approach to a single parenthood, condolences and
Sorry,
appreciation.
ma'am. Sorry, ma'am. In this station, should we discuss with the IVF as well, if in case the IUI is not successful as the patient is of 37 year of age?
See, dear, you can discuss, but then that is actually deviating from a main task. So
Okay.
sometimes you have to be relevant, because um, if the what for what the patient had come to you, the patient had come to you, discuss the options of, because if her tubes are open, there is no risk factor as of now. At the age of 37, there is a very high probability that she might conceive within the next 1 year, because her son is
Yeah.
only 2 year old. Okay, her son is only 2 year. So the most probable options only we are going to discuss. IVF, still she is going to require a male partner, still she is going to require a male partner. IVF, if she is finding it difficult to conceive, but why we are thinking that she will find it difficult to conceive?
Yeah, actually, I'm thinking like the fertility is reduced after 35 years. So that in that
Yes,
behalf, if in
definitely,
case,
but
yeah,
serum
yeah,
progesterone, see, her age is 37, her serum
yeah,
progesterone is normal, and she is having a regular cycles. That means she is still ovulating.
ovulating, yeah, okay.
Okay, so we will consider it as that she is ovulating. There isn't any point in offering her IVF, because this is deviating your task from the main points, and you are getting deviated towards the irrelevant point. If you will not be saying
Okay.
IVF, you will not be the marks will not be deducted here.
Okay.
Yeah. Yeah.
Okay. Okay. Thank
Condolences,
you.
appreciation, explaining in lay language, providing support and counseling, checking understanding at frequent intervals, initiating questions, appreciation at a time, addressing her concerns, fears, discussing all available options in a non-directional way. Okay, so you do not mean you that doesn't mean that having her own biological child with her own person is also an option. So that you need to discuss in a very sensitive manner. That means unless and until you will not discuss the alternatives, you will not be pass in this domain. Okay, so you have to discuss, you have to offer a PIL support group also. Then information gathering, interpretation of GP letter, acknowledging the information, relevant history of previous obstetric history, report, that is serum progesterone report acknowledgement, asking RP's concern, fear and expectation, contraception, STI, surgical history to rule out tubal pathology, offering investigation like HSG, HIV, HBsAg, HIV, HCV, syphilis and rubella, offering support and counseling, information of support, emotional and financial to check well-being of upcoming baby. So you had covered most of the time, most points here in all the domains, dear. It was a very good station when it comes to knowing this task. Confirm identity of the patient, offer her condolences and support, signposting at appropriate time. Reassurance is important. Investigation for STI, HIV, HBsAg, HCV, rubella and HSG. Donor will be screened for infection and genetic disorders. Folic acid, no over reassurance regarding eligibility of fertility of IUI, which you had mentioned in the very beginning. A certain well-being of upcoming baby by checking her financial stability and even family support, because she's a single woman. If she is having any concern, then her family backup should be there. Ethical and legal knowledge associated with funding of donor IUI, discussing alternatives, and ethical and safety, no, legal knowledge about donor IUI. That means you need to know the laws of donor IUI. Applied clinical knowledge, legal and ethical issues regarding donor IUI, success rate of IUI, name of the father will be noted as unknown on birth certificate. This you have to mention specifically. Offering counseling as a part of fertility treatment, because counseling is important here. Eligibility of IUI on NHS and NHS funding. So these are the things. IUI, NHS, these are the reference links, and donor IUI, HFEA, FHF, EI, PIL, these are the links, okay, what are available. Okay, anybody